So bring up chat. So, and I thought I could see chat on here, but did I just stop the screen sharing? Is it still there? Okay.
Nope, still here.
So yeah, if you could all just share that in the chat room. Okay, a math ed undergraduate student. Oh, that's cool. So one of the education courses asked people to attend. Like that. Social studies education. Math education. We do have a lot of education students, elementary education. Okay, so it looks like we do have quite a few undergraduate students. So I'll be sharing some things about undergraduate students and also about graduate students if we see that we do have some graduate students here. So you guys just keep on posting and I'll move on with the presentation. As you heard, I'm an associate professor, which means I just got tenure recently. I've been here 7 or 8 years, can't even remember. Mental health first aid is actually a certification program. It's a 1-day long, you attend for 1 day and then you take a quick quiz and you become certified as a mental health first aid trained person. That's similar to CPR, but for mental health. So you don't treat or diagnose, but you do that sort of first step of getting, helping get someone through it and get them to the help that they need. I've had ongoing struggles with mental health issues myself during my life. So that's something I'm increasingly feeling comfortable talking about and realizing the need to actually talk about these things. And then I'll maybe talk a little bit later, depending on whether we have very many grad students, about this research. Actually, I think it's relevant to undergrads too. Research family model that in a group that I co-lead with Dr. Wanju Huang, who is also from LDT in the College of Education. So let's talk about normalizing the conversation. So I want to break us into breakout rooms for about 10 minutes and talk about, I want you to talk about how is mental health or mental illness thought about in the wider community that's outside of Purdue, and then how is it thought about within Purdue? And do you see a difference between how it's taught about sort of in the larger world or maybe at home for you versus how it's talked about at Purdue? Okay. And Erin, maybe groups of 3.
Sorry guys, give me just 1 minute. It won't let me do it all at once. I thought it was going and then it's not.
And if you want to copy the questions out, I put them in chat if you want to copy them off so you remember what to do in your groups.
Are you guys seeing a message pop up for you to enter a breakout room?
No, I'm not.
Okay, I'm going to manually assign you guys really fast. Okay, do you guys see your messages?
I saw a message, but I didn't take it. So did I misunderstand? I thought this was for grad students.
No,
I
this
mean,
sorry, go ahead, Pratik.
I mean, mainly we try to advocate for the graduate student population, but if you have undergrads as well, which enrich the quality of the conversations, that's completely fine as well. And last fall we had quite a number of undergrads, and it made for a really nice event and a conversation. So I'm for it. So
Oh yeah, it's great. It's just I don't notice a single grad student in the list here. They all look like undergrads. That's why I was a little surprised.
yeah. I guess me and Erin are grad students, so it should be.
Okay, well, go be in breakout. No,
There we
just kidding.
go. Okay.
So summarize your thoughts, and then if you can start thinking about how might mental health concerns impact the Purdue community. So, it's okay if more than one person summarizes your thoughts. Just trying to get an idea of what you all talked about. How do I check? Okay. Where did the chat window go? Okay, I'm going to stop sharing for 1 second. So hopefully you guys are all typing it in chat. I'm not sure why I can't get it to show up for me.
Nothing yet. I don't have anything in chat yet.
Okay. So Ruth says, we appreciated how Purdue is making steps to provide more mental health care through the programs they fund. Good. I'm glad that those are becoming more accessible. I know last year they talked to us about the new model for CAPS, but I know there's a lot of other programs too. So Ruth, what types of programs are you thinking of? So James mentioned grief days that were recently added. Okay.
I didn't know about grief days being recently added through Purdue student government. It's kind of interesting.
So I think I'll come back and kind of read through these in a couple minutes just to keep us moving. Let's see.
Jace says, it doesn't seem like Purdue has done much during the pandemic to support students and their mental health. We don't know of many resources on campus other than CAPS, and CAPS has not been spoken highly of among students.
Does anyone have other ideas for Jace and his group about things that are available at Purdue that maybe we don't all know about?
Jennison says, we talked about how college life was more competitive and how different it was compared to high school. It has led to a sharp decline in mental health for a lot of students.
Okay, I'm going to go through the next couple of slides and then we'll come back and read some more of these. So why should we be concerned? 1 in 5 US adults, including youth and young adults, experience at least one mental health condition. And 75% of all lifetime mental health issues begin by age 24. That means your first event that occurs happens before you're 24 years old. And there's certain conditions, many conditions where right around the age of undergraduates is when people on average start experiencing events. There's a few that are a little later in life, but many start in your teenage or early 20s. And 30% of college students reported feeling so down at some point during the previous year they found it difficult to function. And this was in 2014. So I'm going to give you some other statistics in a little bit that relate specifically to during the pandemic. So this is about grad students in particular. So within the last 12 months, this happened at least once. 24% of students reported this stress had negatively influenced their academics. 41% felt so depressed it was difficult to function at some point in the last 12 months. 46% reported that academics had been traumatic or very difficult for them to handle. 58% reported feeling lonely, and 63% of students reported feeling overwhelming anxiety. These numbers are a little bit different for undergrads, but these are common issues for students overall. And let's see some more of your answers. So Emily said, all of us basically said the same thing. We decided to talk about the communities we came from and how mental health was viewed there. Mental health is important and there's resources, but it wasn't talked about a lot. I feel that Purdue has done a good job emailing us and reaching out about mental health. Obviously, with the pandemic, school hasn't been easy, but I think Purdue has done their best to get life back to normal. And I think that since the pandemic, there's been more acknowledgement in Purdue and the larger community about mental health and the need to share resources. This slide, I forget what year this was, but this was from 2019, so before the pandemic. This is by the American Psychological Association. They found that 87% of American adults agreed that having a mental health disorder is nothing to be ashamed of, and 86% said they believe people could get better if they had a mental health disorder. So this might say something about the fact that people are at least more willing to talk about these types of issues and more accepting of them, even though we might perceive that there might be a stigma, or we might be afraid there might be a stigma, or it's difficult to talk to. But it sounds like a large number of people, at least within the United States, are at least open to thinking about these and not consider them shameful or something that you can't overcome. Now, I have a lot of friends that are from other countries, and they say it's even more difficult in their country to talk about these issues, that it's something not talked about, that it looks weak, that mental health services are something people don't know about. So at least in some countries in the world, there's even a higher barrier to that. And that is actually something to help students learn about, so they might not know that something like CAPS might exist to even go look for it. Okay. So, however, despite what I just said, mental health is a global issue. Let me see if this will bring this up. Let me just, whoops, bring this up in my web browser. So I'm just going to quickly walk through this presentation from the World Health Organization. So here they talk about how mental, neurological, and substance abuse disorders make up 10% of the global burden of disease. I'm not sure exactly what they mean by that. And 30% of the non-fatal disease burden. So I don't know exactly how they define burden in that case, and they don't say. About 1 in 5 of the world's children and adolescents have a mental disorder. Depression is one of the leading causes of disability in the world. About half of mental health disorders begin before age 14. Almost 800,000 people die by suicide each year. So that's one person every 40 seconds in the world as a whole. And it's the second leading cause of death for people in the early adult age range, 15 to 29 years old. About 1 in 9 people live in settings affected by conflict have a moderate or severe mental disorder, which unfortunately makes sense. People with severe mental disorders die 10 to 20 years earlier than the general population. And the rates of mental care healthcare workers vary hugely between different countries. So that can be anywhere between 2 per 100,000 people in low-income countries to over 70 per 100,000 in high-income countries. And less than half of the 139 countries that have mental health policies and plans report having these align with human rights conventions. So that's another big concern. And then I never know how people come up with these kinds of numbers, but it says the global economy loses about $1 trillion per year in productivity due to depression and anxiety. I think that's the last one. So just to give you a picture, this is something that's happening worldwide. This is not specific to one culture, one ethnic group. It's not specific to people in high income countries. It might be talked about, or there might be more services in those countries, but these things affect everyone around the world. Okay. So a little more from the World Health Organization. It's very interesting how they define health as being a state of complete physical, mental, and social well-being, not just an absence of disease or infirmity. So see how they actually focus on mental and social well-being, and the fact that they use this word well-being and not just disease. It's not just mental disorders versus, you know, not mental disorder, but this is a wider look that they have on it. And they define mental health as a state of well-being in which every individual realizes his or her potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. So notice that the World Health Organization sees mental health as something at a community level, not just an individual level. Okay. So we talked about this. It's more than just the absence of disorders. It's an integral part of health. There's no health without mental health. Mental health is determined by a range of socioeconomic, biological, and environmental factors, by which I believe they mean that each of these can impact mental health. And cost-effective public health and strategies and interventions exist to promote, protect, and restore mental health, that this does exist. It's been proven to show that there are cost-effective ways to do this. So before we go back, we're about to go back into our little talking rooms, but let's see what else came in. So Samantha said, we also talked about how mental health isn't really talked about a lot in our high schools. As far as Purdue, we found there are more ways for students to get help, such as CAPS, although the pandemic has caused a decline in the mental health for many students. Yes. Emily shared that we talked about how mental health is portrayed in high school. So there's a couple of people talking about high school. Oftentimes they show extremes of anxiety and depression that we did not relate to, and rarely talked about other mental health issues. That is a really great point. We think Purdue is better about understanding mental health. So that's something. There's also organizations that are working to get more knowledge into the K-12 community. Although I think, again, it might be more focused on teachers identifying problems versus training students. So that'll be those of you who are education majors. I'd love to hear if you know of other initiatives that are going on in K-12 that are aimed at students. Erin, do you know of anything related to that?
I do not.
Okay, that might be something, especially if we have a lot of education people again, that we might want to look into. Okay, so is talking about mental health too much information? So think about how much we know about other aspects of physical health. How willing are people to disclose visible physical health issues? So like when I broke my ankle, not only could everyone see it, but everybody was, oh, how did you break your ankle? How can I help? You know, what can I do? Do you need anything? It was very open, right? There was no lack of willingness to talk about the broken bone. Non-physical health issues, so cancer, diabetes. If you can type in chat, is this something that you think people generally share? If they have something that's a health issue, a serious health issue, but you can't see it on the outside of your body. What's your experience with that?
Do you want them to say yes or no, Marissa? If yes,
Sure.
they've had that
Yeah.
experience.
No, people don't. Ruth's experiences, they don't share. Not really. Okay. Depends on the situation. Interesting. So I think that's true. It depends on the situation. In my experience, it sort of depends on the context too, or how well you know people. It depends on the person. I'm surprised how many no's I'm seeing actually, because I've seen a lot of people share about this type of information, at least on a kind of one-on-one basis. So that's really interesting. So people seem to be much less willing to share information about non-visible health issues. Okay, so what about mental health issues? Is that something that people talk about? Well, that's a good point. I'm seeing it more and more as I get older, but this was rarely discussed when I was younger. So I wonder if that's something they didn't discuss it with you because you were younger, or if you think that's a change that's going on right now. It may be that people don't discuss with children and you're all, becoming adults, or you're adults right now. Great point. So let's go into the breakout rooms and discuss this a little bit further. So let's think about, and I think we'll bring this down to 5 minutes because we're running overtime. The media talk, somebody said the media is talking about it, which makes people comfortable to talk about. That is a really great point. So let me just go out of here so I can paste this question in the chat. So we'll be talking about why is it acceptable to share some health concerns and not others? And what would it mean to normalize the conversation about mental health, or maybe even about these non-visible physical health issues? So let's do 5 minutes. Okay, good point, Jefferson. So Aaron, at 4 minutes, can we do the thing where they have it's going to yank them back in 60 seconds?
Yeah, I've already got it set up that way.
Great.
Can you guys see your notifications for the breakout room?
I saw something and then I said no.
Yeah, even I could see it.
Okay.
It looks like we just have a few people still in here.
Okay, gotcha.
There we go.
It's just slow.
Let's see if Chloe. Because it gives you like a minute to accept. I kind of wish it would just yank people in there.
Oh yeah, me too, yeah.
Chloe, are you still here? So I was really surprised at how many people said no to that. Almost everyone said no to that last question.
You know what? I was too, and I'm wondering if they misunderstood and thought, how comfortable would you feel volunteering that information about your mental health?
Well, I was asked, and maybe this was confused. I was asking, what I was trying to get an answer was about the physical health.
No, I know. I'm just
Where'd it
wondering
go?
if, because there were so many no's, I'm just wondering if maybe they didn't hear
Oh,
that.
if they were thinking mental health.
Yeah.
Yeah.
Because I thought that was unusual too.
I mean, I know this used to be the case, but I thought nowadays people are pretty, but again, maybe I've had weird life experiences, but I thought people were pretty open about this kind of stuff.
Yeah, I think you're right. From my experience anyway.
But again, I do wonder if they were answering this. I think you're right. They probably were answering that. But I do wonder if this is a situation where they never really encountered it because they were children.
Right. Right.
I know my mom said her parents never told her if anyone was sick. The only time she heard someone was in the hospital is when they died. So she thought, you go to the hospital and you die, basically.
So awful. Yeah, I could see how someone with cancer, especially if they're have a poorer diagnosis than someone else, might keep it to themselves for a while. But something like diabetes and that kind of stuff, I feel like is pretty open, pretty fair game in my experience anyway.
I mean, I've noticed in a work setting that people know because people know people are getting treatments and they're in and out and they're making special arrangements. So I don't know if we know when everyone is, but I know over the 7 years I've been here, there's been a number of people
Right.
that at some level, it's like who wants to send flowers and then people are helping out.
Right.
But again, that might be very different when you're sharing with, you might not share with your undergraduate students or your,
Right.
great nephews and nieces or whatever. Real that you should consider, and then there's ways to get help for this. So mental health disorders can take many forms. So first, a mental health event is defined clinically as showing ongoing symptoms that can impact your daily life over a period of weeks. So again, if you're just really sad for one day or really angry for one day because of something going on, that's part of the normal range of human emotions. But when these are going on for many weeks, that could be indicative of a disorder. These can be pretty mild to severe, the severe being the point where you cannot do a lot of normal daily activities. Sometimes it's due to a specific traumatic event, like a death in the family or injury, but it's not always. So just because something didn't happen doesn't mean that there's not, that the person is not having a mental health event. Sometimes you can have one event in your life, it never happens again. Sometimes it happens a few times in your life, but for some people, these mental health disorders are ongoing. However, it's important to say that feeling down, stressed, or anxious does not indicate you have a mental health disorder. Despite that, it's always okay to seek help. And that goes along with that comment someone posted earlier that it's okay when you're just, feeling overwhelmed. Maybe you're not sad or angry, but you're feeling overwhelmed. There are people who can help with that. They can give you strategies or tips. They can help you think of other ways to think about things. So you don't have to wait until this is seems to be a clinical disorder. You can get help. And this is a normal thing that is available to students on campus and more to, generally out in the world. Erin, did we have any more new definitions?
We do. We have one, and it's from Noah, and he was saying that therapists are doctors, just like all teachers are educators. We need to stop making them seem like a crazy place to attend, meaning doctors, I'm assuming.
Doctors and therapists. Yeah, that's a great point. Yep. Everyone can go see a therapist sometimes. And sometimes you just see them for once or twice. Sometimes you see them on an ongoing basis for a while. But they are there to help you. Okay, so this actually ties a little bit in with Noah's comment. And I'm just to tell you briefly, because there's a lot of misunderstandings about this. I'll jump down to this third point. Psychiatrists are doctors, medical doctors who have an MD that are specialists in mental health, and they can prescribe medications. So only psychiatrists and these psychiatric nurse practitioners are the only ones who can prescribe medications. But there are other people that can diagnose and offer therapy, including clinical psychologists, school psychologists, counselors, and therapists. And here you can see there's a lot of different titles those can have: social worker, counselor, mental health counselor. There's people that are specifically certified in alcohol and drug abuse. So there's lots of names of these types of people. And there's different types of therapy, and I will not go into those today because that's not my job. But there are different varieties of therapy that can be used in different ways for different people. I will also say that some therapists, if you go to a therapist and you don't think it doesn't seem helpful, or they just don't kind of click with you, you can always try a different one, because they all have different personal styles and they also have different techniques that they use. And by the way, CAPS does have a psychiatrist on staff. And PUSH has a psychiatrist on staff, and CAPS has therapists, and they will refer you to each other. Okay, so now I'd like to talk about today, or especially the last year. I had actually, this was sent to, I think, all of the faculty in the College of Education by Aisha Sifchi. She's a professor of counseling psychology in the College of Education. And last August, she sent an email to everyone about what she called the 3 pandemics. So we know about the coronavirus as a pandemic. Then there's longstanding racism, which she defined also as a pandemic. And then this sort of that those put together. So the mental health crisis that's related to those first 2 pandemics and other factors, as those being sort of these 3 pandemics that everybody was going through last year and continues to go through. Come on. Oh. So we should assume that everyone's experiencing and has been experiencing some level of mental health issues or stressors, but that doesn't mean everyone has a mental health disorder. So many people felt extremely stressed, especially last spring and summer. And, you know, many of us in the fall as well. But that didn't necessarily mean all of us felt a mental health disorder, but that there was sort of this constant level of stress that everyone was dealing with. And many of us could use help with. So let's talk just a little bit about COVID-19. And I'm pointing out a few facts here that are particularly relevant to us. More than a third of Americans displayed clinical signs of anxiety, depression, or both. And this was as of May 28th, 2020. 18% experienced nervousness or anxiety most or all of the time. And again, this was last spring. Pandemic stress, and I haven't read up on this since then, but at the time nobody knew why. It seemed to be significantly higher for younger people in the 18 to 29-year-old age group, even higher than other people. And by the way, this is a really cool website. It's called yougov.com. And they have, pull from surveys that are done all around the world. And they have a whole bunch of different, all different topics or variables that you can look at to see how people are responding all around the world. But here I just picked out a couple of these that were related to COVID-19. So this was the percentage of people that said they were very or somewhat scared of catching COVID-19. So you can see last spring that, you know, rose sharply. But interestingly, it's been sort of between this 50 and 60% timeline ever since then. And by the way, this is what it looks like. You actually can look at a whole bunch of different countries in the world and then highlight one particular country. So I just showed that because I thought it was cool to see all the different countries. So this is perceived national improvement. So you can also see that people in different countries had very different things that they believe were going on in their country. But here in the United States, you can see that across the last year, we've had a lot of ups and downs of whether we felt our country was improving related to COVID-19. And now we're going on a high, right? Probably because of the vaccines, people are feeling like things are improving in the United States. Okay, I'll skip over this one. So responding to COVID-19, you all probably have seen this now for a year, hopefully, but these are some of the tips. Some that we can think about that maybe not everyone has been as focused on. Take breaks from the news. I know around the election time, this was another reason to take breaks. This could be just watching the news only during certain times of the day, or, you know, sometimes I took 5 or 6 days off from the news. I just needed to take that time off. Taking care of yourself physically and take time to unwind. And I know that some of you even expressed this earlier. This is a high pressure time of your life here in Purdue. And a lot of students feel like if they take any time off, they are doing something wrong, or they're wasting the money, you know, and resources that they or their families put into bringing them here. But the reality is that everyone needs to be able to take some time to unwind every day, every weekend, you know, some weeks during the year. If you just keep going and going, that can impact your mental and your physical health. So that is normal. This sort of work-life balance is something that people need to work on throughout their life. So that's one thing that, you know, I'd like to tell you all is that's important. Also, in terms of academics, in terms of mental health, physical health, if there's one thing that somebody said, if there's one thing you can do, get enough sleep, because that plays into all of those. So making sure to get enough sleep, and that often means some relaxing time between when you're doing your work and when you go to sleep at night. We'll give you a link or a copy, I think, of this presentation, right, Erin? So I've got all kinds of links in here that you all can look at. Okay, so now remember the second pandemic had to do with racial inequities. And here again, I'm going to point back to last spring just to demonstrate. So right around May 21st is when that video of George Floyd's killing started to be, oh, it says the last day of week 4. So whatever that was, May 26th or whatever, when that video was shared widely. And you could see that there was a spike in anxiety and depression among Black Americans, but also among Asian Americans and Asians within the country. So an event like that can suddenly cause a very sharp spike mental health issues. Here's another way to look at it. It's comparing between 2019 and 2020 in that same week of the year. You can see that these levels were triple the amount they were from the year before. So that sort of event happening, even if it doesn't happen to you personally, can have a big impact and can impact different people in different ways. Some more great resources there. And both of these meet the definition of collective trauma, which is a psychological reaction to a traumatic event that impacts the entire society. So not necessarily to you, but it's something that's going on in the society as a whole, which includes wars, natural disasters, mass shootings, terrorism, pandemics, systematic and historical oppression. So we hear some things that have been going on there. And the scary thing is that long-term psychological consequences of collective trauma can last up to a decade or more. So even when we got all the vaccines and, you know, COVID-19 is under control, it's okay that maybe you don't just snap back to everything's perfect again, right? That people are still reacting to that situation. So how can we help when there's a collective trauma? Help ourselves and help others. We need to make sure that everyone is treated as a person of value. When people are treated as if they don't belong or just deserve to be excluded, that can cause really deep psychological wounds. And sometimes we really need to think, what things are we doing that would cause somebody or some group of people to feel this way? Making sense of life allows us to reconcile the challenges we face, hopefully emerge stronger. Everyone knowing that they're not alone, and that even if you haven't personally experienced death, this is even more true. But even when this trauma is sort of as a society as a whole, we can see that there's this grief process that we go through. Okay, so here I wrote grad students, but we can think about this as college students in general. So we're going to get into groups. Let's do 5 minutes again and talk about what stressors that you particularly are tackling or have been tackling or dealing with. I was lucky about what happened in high school. I was lucky that the SAT went so well. You know, I don't really belong here. When other people are telling you you're doing a really good job, you deserve to be here. That is sometimes what imposter syndrome can look like. So some other symptoms would be feelings of self-doubt, the inability to realistically assess your competence or skills, which often you see again by someone else saying, that was really good the way you did that. And you think, no, it really wasn't. Attributing your success to external factors, or like I was giving example, luck. You feel like I was just lucky, that's how I got here. Or I got here because, my science teacher recommended me and that was, the way they did that was so great, that's how I got here. Fear that you won't live up to expectations. And often these people are overachievers. So this is something you might not notice, but other people might point out. So this can lead to you berating your own performance, sometimes actually sabotaging your own success, or setting really challenging goals and then being disappointed when you fall short. So I'm going to do all of my schoolwork and I'm going to have to get at least, high 90% on every single thing. And I'm going to be on these different, this many different extracurricular activities, and I'm going to work 25 hours a week. And if I can't do all of that, then I'm not good enough. Then I shouldn't really be here. When in fact those are unrealistic goals, and when you can't do them all, and or you're trying to do them, you're not getting enough sleep, you feel horrible, that's setting something that is so challenging it's unrealistic, and your disappointment is possibly because of an unrealistic super challenging goal.
I'm going to
So
read. I'm
some
going to read some of the chat, Marissa, if you don't mind, just because it's piling
Great.
up, and I think it has a lot to do with this slide. One student says social life can be a stressor, like struggling to balance both grades and friendships.
Mhm.
Another says finding a friend group support system. Another says our group talked about tests, deadlines, social lives, homesickness, and unknown hybrid class structure, which can be stressful. Here's one that relates directly to imposter syndrome. The stress to never fail in anything that I do, getting subpar grades makes me feel as though I am subhuman. A new environment, a struggle to succeed, increased workload, feeling lonely. Hybrid and online classes, trying to keep up with discussions, assignments, or when classes in person or over Zoom. Everything is overwhelming. It's hard to even pinpoint a specific thing because it just becomes an overwhelming, all-consuming dread. Plus, if I fail, I would lose my scholarship and have to drop out. And finally, making friends, exams, self-doubt, and money. So that's a
So we
lot.
hear some of those really are particularly worse this year, right? Because hybrid classes and what's involved in hybrid classes and how they're very different from what you might be used to. But many of the things that you discussed are part of the college experience, or part of trying to juggle the college experience. A lot of people feeling overwhelmed. So let me see what I've got here. So here's some of the recommendations, and these are specific to imposter syndrome, but I think, or these were given in an article related to imposter syndrome, but I think that they are very relevant to some of the other things that you've been talking about. So talking to your mentors, and mentor can be your advisor, but it doesn't have to be your advisor. You can have multiple mentors. There could be a more senior student. There could even be a peer mentor where, each of you have some area of expertise or some area of strength, and you help each other out in that way. And one of many things a mentor can do to help you is help you recognize where you have grown. So a lot of you might feel like, all I've done is fail this year. Everything's just been so stressful, and you can't even step back and see all of the things that you have learned and done and how you have grown this year. So maybe these online classes have been really hard, but it could be that you're doing much better at knowing what's expected in those online discussion forums than you did originally. Maybe you're understanding better how to read these types of textbooks than you did originally. Recognize your expertise. So you didn't start from scratch. You came to school with a lifetime of experiences. Many of you have work experience. You've had things you learned in high school. You've had interests of your own. Maybe you've had independent things that you've taken on, and none of those go away. So I think this happens, when you enter college. It happens again when you enter the workforce, when you enter graduate school. There's something that happens where it feels like I'm just a kindergartner again. Like I know nothing, although kindergartners don't feel it this way. I think they know everything. But, I'm a student and I'm starting at zero again. But actually, again, you have a lot of things that you bring in, so you can find creative ways to use those either to inspire yourself, or sometimes even as part of a project, draw on an interest that you've had or a hobby that you've had, draw on your work experience, maybe do a project that's connected to something that you do on your job, or something that you do in a service activity. Find ways to make those connections, both to help keep things manageable for yourself, but also to help you understand how everything fits together in the world. That actually can make things more interesting and more manageable. Remember what you do well. And this article actually suggests that you write down your strengths and your areas for growth. So don't think of them as weaknesses, think of them as areas for growth. And then you can come up with a plan of how do you want to work on these, not all at the same time. You're here for 4 years, right? So maybe, each year or each semester you can work on one of those things. And some of them you definitely will keep working on after you're done here. So being done with college doesn't mean that you're done with your education or done with preparing for life. Certainly my experience is I'm a faculty member now, but I still have so many things to improve on. And as long as I keep doing some of those, that's just normal. Like we don't have to be perfect or ready or fully prepared when we walk out the door here. Realize no one is perfect and do a task well enough. You don't have to get 100%. And even aside from that, you don't have to do something perfect in the first go. So one thing I work with my students on a lot, because I do like a writing proposals class, research proposals class, is how valuable it is to make a draft. So don't wait until it's perfect to share it with me or share it with a peer and get feedback. Write a draft, get some feedback, and make some improvements. If you just wait until every single sentence is perfect, then maybe it's too late to even get the feedback. Instead, go ahead and get the feedback, or go ahead and say, you know what, I've spent 10 hours on this thing, but maybe, you could spend 20, but how much would be better if you spent 20? Is it enough to be worth that extra 10 hours, or have you done good enough? Change your thinking. And they talk about these as superstitions. They aren't exactly what you think of as superstitions, like, walk, whatever it is, if you walk into a mirror or something happens. But there's these beliefs that you have about the world that might not be very realistic. Again, if I don't spend 10 hours preparing for a presentation, that presentation isn't going to be good. And then talk to someone who help. If you feel anxious or fearful, and again, we talked about going maybe to a therapist, they can help you sometimes with tips and suggestions. You could go to the writing center, they can help you with writing. There's lots of people that can help, and there's no weakness in talking to those people. Are there any new entries there, Erin?
There's no new entries other than my own personal comment that says I think it's a really tough one for so many students when you were talking specifically about writing.
Mm-hmm.
I see it a lot with my students, and I know that I do it myself, is I wait and wait and wait till I have everything absolutely perfect before I show someone. And you're absolutely right. The amount of improvement versus the amount of hours I put in is probably not
Mm-hmm.
worth it. So.
And there's a lot of strategies for that too. And just because I do work with students on that, that's one thing I notice is people feel like they should be able to just write it and it should come out. But actually trying to write it perfectly the first time is a very inefficient and not very realistic way to do it. So some people start with an outline, some people start with kind of a brain dump, but you kind of go through and get your thoughts out. And then you do the next level and kind of sketch out the sentences, but you don't try to make the sentences perfect during that time. You have a separate editing time because it's too mentally, it's too much cognitive overload, right? There's too much mental processing necessary to both come up with ideas and make your English perfect at the same time. So that's one suggestion. There's a lot of different ways to deal with that, but basically kind of doing things in phases and not trying to do it all at the same time. The same time, similarly, when you all talked about balancing all these different responsibilities, some of the things people do is block out time blocks in their calendar, and that kind of frees you up. This is the time I'm working on studying for this. This is the time I'm writing. This is the time I'm doing emails. So that when you're working on one of those, you're not drawn in so many directions and panicking about everything else. You can focus on that thing. And when that time block is over, then you go on to the next thing.
I think for those of you that are graduate students, that's really great advice, because as a parent, I cannot function right now as a parent, PhD student, teacher, wife, all that kind of stuff, if I don't have those blocks and make myself stop at a certain point of doing whatever task it is to move on to the next task. So I think
And another thing about those blocks is that you make them a meeting. It's like you're meeting with the dean, right? That's your time. Other people don't get to schedule. Now, when you have kids, that's sometimes not quite possible. But generally, you don't let other people schedule themselves into that time. You don't let yourself do email when it's your writing time, because that is an appointment with yourself, which is just as important as an appointment with someone else. And that allows you to focus on that work. Because otherwise, and I see this myself, suddenly it's 2 a.m. and I'm still working because my whole day was put into meetings with other people. So maybe the first meeting of the day should have been my meeting with myself to do whatever the top priority thing is on my list. Does anyone else, if anyone else has some great ideas for some of those stressors we talked about, please post them in the chat and we'll read them in a couple minutes. Okay, so this is, okay, we're running out of time. Erin, were you going to make an announcement about time? And
I was, thank you for the reminder. It looks like we're going to run a little bit over. So thank you so much for those of you who need to leave at 7 o'clock. We completely understand. And thank you for your attendance. Those of you who can stick around are absolutely welcome to do so. So we're just going to keep going and shouldn't run too much over.
So these are recommendations by, I think this is the National Alliance of Academics in Science, Engineering, and Math, or something like that. You can click on the link later and find out. But these are their recommendations for college and universities that need to have what they call campus-wide culture change. I mean, it makes sense, that's what it's called. So their suggestion is that campus cultures need to change to better support student well-being. And notice that they're focusing on the word well-being, not mental illness, not even mental health, but well-being. These are their recommendations. Institutional leaders should articulate the importance of creating a culture of well-being on campus. So this is presidents, provosts, all the way down. Institutions should provide faculty training on how to create an inclusive and healthy learning environment. Students should be provided structured opportunities to learn about individual well-being and the cultivation of a healthy, respectful campus culture. So we all have a role. The leaders, the faculty, the students all have a role in this campus culture or campus climate. Institutions of higher education should work to ensure students have access to high quality mental health and substance use treatment services. And I think this is something that somebody might have been referring to earlier. Well, you talked about grief leave, I think, but the idea that people have leave of absence or re-enrollment policies, which we know are available for people that have physical health issues and other types of things going on in their life, but that these should also make sure that these meet the needs for those experiencing mental health and substance use problems, and that this provides enough time for effective treatment and recovery. And this is something that if you have these things going on, you can talk to the Dean of Students office and they can help with this. But their recommendation is to make sure that those policies really address the specific needs of mental health, and that and I don't think this is the case at Purdue, but that you don't want those to say, well, those mental health issues, they can have a week off, but they need to be back. That's not like how we would treat cancer or something where somebody needed to take time off to get medical treatment. So we want to say, mental health, not only during the episode, but you may need more time for treatment and recovery for actual diagnosed mental health issues. So these are just some ideas that they have. And I don't know what you all think. I think Purdue is doing some of these things, and maybe some of these are continued areas for improvement. Let's see. I was going to talk to you briefly about my own research group. Now, this is right now graduate students, but there's no reason that we couldn't include undergrads in this type of thing, or undergrads couldn't create something like this themselves. So we had what was originally called a research group. We were very focused on research and writing papers and reading academic papers. We've moved to what we call a research family, although we don't just do research. So we were trying to work on a phrase that worked for us. But basically, myself, the co-leader, Dr. Hong, and a number of students, so most of them from our program area, but we've got some from Polytech and from different areas. have a group that get together once a week. And some of the things we do, we have weekly check-ins. So the first half hour or so of our meeting, we go around, check in, talk about celebrations, challenges, concerns that people have. Those concerns could be about this work-life balance. They could be about a paper or something that they're working on, or a problem they have teaching. Could be anything that's on their mind. Sometimes people are preparing for job interviews. And then first, we talk about what resonates with us. Oh, yeah, I feel that way sometimes too. And this is how I've dealt with it sometimes in the past. Sometimes we have, well, we've heard this works, but we don't really do it. But do as we say, here's some of my very research-based, because this is a research group, but we also talk about common challenges and topics of interest. So we've done readings related to mental health among students, imposter syndrome, different career paths for people in our areas. We've had writing at time activities where we are writing a joint chapter right now. We have just in time topics. Oh, I guess I never finished typing that. But like one of the people was going to go on a job interview. So we spent time talking about what job interviews are like. In this case, it was an academic job interview. So the two faculty members said this, in our experience, these are the types of questions that were asked, or these were the ways that we prepared. Share our experiences. And the most important thing, and why we think of this as a family, is that we're respecting all the members for what they bring and where they are right now. So each semester, even each week, we might do different things depending on where everyone's at. Everyone has their own life experiences. We've got a very diverse group from different parts of the world, different interests, different, previous jobs that they had. So what is it that everyone brings to share? And this is a model that we are writing about and talking about, how can we do something more like this more broadly across academia, to give people a feeling of support and a feeling of value of everyone's unique things that they bring in, rather than that sort of deficit model that I talked about before, like, or not deficit, but you come in as like this empty bucket. They used to say minds are like this empty bucket you fill with knowledge in school. And another, more modern way to look at it is we're all connected to each other and we all bring our unique things and we can all learn from one another. So that's the atmosphere we have among our group. Let's see. So those are a couple of ideas that I had. And why don't we just go ahead and type these right in here? We don't have time to separately break out and come back again. But are there other things that you think could change on campus? And what can you or we do to facilitate the change? So we know that we can hope that, Purdue or the president or whatever does whatever they do. But what are some specific things that we can do? You, the students, or we, the faculty, what are some things that we as a group can do to help with this change, to normalize the conversation and to support one another? Okay. So Erin said create support groups. Erin, can you say a little more about that? How students could do that?
Sure. I just think it's something easy that either an undergrad or a graduate student has the power to do, and that's kind of just get people together, either on a kind of social level or not, but maybe on a weekly basis, and just be able to talk about stuff and what's stressful and what's not stressful. And I think having an hour a week with kind of people who are in your corner can do a lot, and that's something that can be created by students.
One thing I found, I was in a support group for, this happened to be people writing their dissertation when I was in grad school, and I'm in another group for faculty now, is they don't have to be in your same disciplinary area. In fact, sometimes it's nice if they're not. If they're people from somewhere else on campus, because then you can talk about stressors that are going on locally with you. If the people in your support group don't know any of the people involved or any of the situations involved, and you feel free to share with them. So it
I
might
think,
be, you might have other similarities with them, but
well,
maybe they're not in your local.
I think it's extra validating too to get that support from outside of your department, because so much of the stress is coming from your own department, that it's more validating to hear other people say it's okay, or whatever, because you know that if you're, you may have a colleague or a fellow student or someone in your class who can do that for you too, but it may be, it's still great, but maybe not as effective.
Mhm. And there's lots of kinds of groups. So some of the groups could be, help each other figure out challenges or just be an open space to share. But you can also form a group, a study group where and there you probably want, with people taking the same class. I used to be in a group with all the people in physics class because it was hard, and we sat and did our homework together and helped each other. I mean, we were each doing our own homework, but we were helping each other with it. A writing group could be a place. Sometimes you're sharing writing and getting feedback, but a type of writing group that I find really useful is where we all agree for the next 1.5 hours, we're all just writing. So we tell each other what our goals are. Then we have, an hour and 15 minutes or whatever, where we're all writing. We turn off our email. Everybody's quiet. Everybody's writing, but we're all sitting at the table together, ideally. Or now, like, we keep whatever Zoom or whatever running, even though we're all quietly working, because then you feel like, okay, I'm expected to write. We're all writing. We're all in the same place. We're not checking our email. We write for that amount of time. And in the last 5 minutes, we all check in and say what we did. So that's another kind of support group. Let's see. Do we have some more comments, Erin?
Yeah, sorry, I was muted. Yes, we have Jennison who says, we can help each other by remembering everyone deals with their issues differently, and there is no foolproof way to help someone get better. We could normalize not being okay, so we can talk about the stressor in a safe way.
Great. That's a great point. Another way to help each other, I'm looking at my sticky note because I was just in a workshop and I wrote this down. When we're supporting each other, that asking questions is more important than giving answers. Often, especially in the support group situation, people need to talk it through with another person, but they don't need you to jump in and say the answer right away. Sometimes they just need to be drawn out, themselves drawn out.
Does anyone have other ideas that they might want to share in the chat?
Let's see what I've got here. Okay, so I just want to point out a couple of things. I think you guys know this, or maybe you don't know. So when you get these slides, think about this. There's not a patchwork, like a network of all different kinds of support systems at Purdue. And if you don't know about all of these, like if you've only heard about CAPS, there's actually a lot of other places at Purdue where you can get support of different kinds. In addition, there's this larger Purdue community, which is, I think, what we're talking about now. How can we support one another? So, and we'll have a little time after if we want to talk any more. We can tell you what we do know. We don't necessarily know about all these, but we can talk about that. Now, just so you guys know, if you're really concerned about someone, they're not having normal stress, but you're really worried that they could be of harm to themselves or others, I just wanted to let you know that these are the things to do. If you really think they're imminently in an imminent crisis, they could hurt themselves or others, call 911 and specifically ask for, now the meaning of the abbreviation, just crisis intervention trained officer. So there's always one officer on duty who is crisis intervention trained. They know specifically how to deal with these types of situations where there may possibly be a mental health issue involved or substance abuse issue involved. So that's the first thing that you would do. If it's not an imminent crisis, but you're worried about them, you can strongly recommend that they call CAPS. If they are faculty or staff, they don't go to staff, then we go, or CAPS, we go to Center for Healthy Living. If you're concerned about an ongoing pattern of behavior that seems worrisome, whether it seems like whatever it is, it doesn't have to be mental health related, but it could be. You can file a student of concern report with the Office of the Dean of Students. It's an online form, and I have a link in it in some of the later materials, and I've just got a bunch of links for you all. a faculty or staff member can file this, but a student can file this about another student. And basically you just describe what the things are that concern you. And they will not know that you're the one who submitted it, but someone from the Office of Dean of Students will contact that person and learn more about what's going on and connect them with resources. Now that resource could be CAPS, but they have a lot of other resources to help people too. And I don't know, maybe with financial situations, or if they need to take leave to deal with a family situation, they can help them. So you just fill out the online form, they will contact them and they will offer them help or help connect them with different services. Okay, so I think we don't have a lot more time. Do we have some more comments in the chat?
No, it was just someone who had to leave.
Okay. So just some other, you'll see these links in the slides, but these are some of the other organizations or some of the other services on campus. Steps to Leaps website, they have events and also resources for well-being. This is a booklet I'd suggest you download. It's called Starting the Conversation. And I don't know if College of Ed students received that this year, but we had recommended, a group of us had recommended that we give this booklet out. It has a lot of information about mental health issues and stress in college and where to go and how to deal with different aspects related to this. So I definitely recommend you download this and take a look and share it with other people, other students that you know.
And I just put it in the link for everybody to click on.
Great. Okay, so does anyone have question, comments, anything you'd like to share? You can type it in chat or you can go ahead and just put the audio on now and talk with us. And as a reminder, please both click the registration link and the feedback or the attendance link and the feedback form. Right, Erin?
Yes.
We might want to share those again. Whatever it is, whatever it is you said.
You might have to scroll up a little bit to find it, but yes, please click on the attendance link to log your attendance and then take 30 seconds to fill out a feedback form. That would be great.
So does anyone have any questions or comments?
I have a comment. I think it was really great and kind of reaffirming to see the data on COVID and the increases and what kind of COVID has meant in context to all of this. I know that when we talked last year, it was so, everything was so, it wasn't the same situation that it is this year. So it was nice to see some of that, to actually see some of that data, because forever we didn't have that data. So I really appreciated that.
Thanks. I know for me, at least, it felt more intense last spring, and now it feels like we're kind of used to some of it now, but it depends on the person.
Yeah, I think that's a little dangerous though, because I'm noticing, with colleagues and with also students and stuff like that, that we've been dealing with this level of stress for so long, this kind of nebulous, intangible, but yet always present level of stress for so long that it has become the normal state of being, but it's still completely deteriorating everything, mental health, physical health, all that good stuff. And we've now just kind of learned to deal with it and to feel crappy a lot. And I think
that's true.
I think that's even more dangerous, especially when I see it, in students who are just, trying to get out of that.
And one thing I noticed, I don't know if this is true for everyone, but I've noticed that I'm in so many more meetings and things that require being online that it's just filling up all time.
Yeah.
And that can be pretty exhausting. In fact, there's some studies about how it's more tiring to be watching things on the screen. And I forget why. There was something about that you don't see some of the other subtle clues. So you have to focus more to see some of the communication cues that people are giving, which can be tiring, especially if it's ongoing.
Yeah.
And then I know a lot of students are also concerned about getting a job, what things are going to be like, whether there will be jobs. So that's always a big stressor.
All of those same, everything's just been heightened. All the concerns are there that were there last year. It's just now it's exponentially more difficult to kind of cope with and to deal with.
So for those of you in education, are you able to go out to the schools to observe, or do your I don't know, what are they called, clinical hours? Are you able to do that now?
For me, I'm able to go to the school, which is really nice. I'm at Hershey Elementary and I'm with kindergartners, so it's really fun to be with them.
Yeah, I know this has been, I know several people who are in places where nobody's been going to school, and that's been really hard on kindergartners especially, which makes sense because socializing is the main thing they're supposed to be learning in kindergarten, right? Or one of the main things.
I have a question for the group. For those of you who are undergraduate students and in education, have you found your field experiences to be more stressful or de-stressful? Or distressful, excuse me, more stressful or distressful compared to if you didn't have them at all? Like, are you finding that additional like COVID layer to be more stressful, or do you enjoy being out there kind of in the world? If that makes sense as a question. And anyone can chime in.
For me, I think it's more stressful because I'm with kindergartners as well, and I'm actually kind of worried about getting COVID with the kindergartners. I don't know if that's like a concern anyone else is having, but like that was a big concern for me.
Yeah, I could totally see that, especially with younger ages who aren't as great with the hand washing and all that kind of stuff.
I think I've read that they've started to see that transmission that is happening at schools is not happening in the classrooms.
Yeah.
I think that's especially true, like with high school students, that it's happening in the sports and extracurriculars and out in the hallways. I don't know about the schools you've been in, but I know the schools my kids are in, they have, you know, it's a little unfortunate because they can't do a lot of the free flow stuff they could do, but they have very specific procedures for everything in the elementary school.
We have a student who says, less stressful, actually being around people is more comforting than my fear of COVID right now. The second student agrees, and the third student agrees again. So that's good to hear.
Yeah, and I think different people have, especially depending if you're an introvert or extrovert, some people have even more need to be around, physically around people than others. But I've heard a lot of people that say, I'm an introvert, but even I, by last summer, they were saying that.
Yeah, that's me. Okay. Do we have any other questions or comments for Dr. Exter? Okay. Unless there's anything additional, Dr. Exter, do you have anything additional that you'd like to add, or?
No, it's been great to see you all. And I know I just kind of rushed through a whole bunch of stuff, although it's been a long time we've been together. You know, if you have any other thoughts or suggestions for when I do future presentations, I would love to hear that. So I've got my email address up. Erin, how will they get the PowerPoint?
I can either distribute it or it will probably be posted for PGSG, but I'll handle that.
Okay, so let me just point one thing out. The last slides are all a whole bunch of different links. So check that out, because we've got all different on, you know, all different aspects of what I talked about today. And then if you actually want to see any of the research or recommendations that I talked about, those are all at the bottom of there's links on the bottoms of the slides. I try to make all of these something publicly available on a website or something. So everything that's on there, you can read more about. And then the ones at the end are really more resources that you can use.
Great. Great. Well, thank you so much, Dr. Exter. Thanks for those of you who stuck around for an extra 15 minutes. We appreciate it. And thanks everyone for their time. We'll see ya.